much. All right, hello everyone. Thank you all for coming to our very first seminar of 2024. I'm Tayaba Khan, Program Manager for the Sparkman Center for Global Health, and I am really thankful to you all for coming here, and thank you to Dr. Gartin for doing this for us. I just wanted to make a little announcement for all the students here. So our 2024 UAB Global Health Case Competition is going to be on March 2nd. Registration for teams and individuals opens this Friday. More information will be available on our website. Keep a look on our social media, and we have a couple flyers here too, which I can share with you all. If you have any questions, you can ask me or our staff back there, Cameron. The competition is on March 2nd. Registration opens this Friday, and it closes on February the 9th. You can register as an individual or as a team, and we'll put you in a team if you register as an individual. So just something to be on the lookout for. And then I'm going to just do a little bio introduction for Dr. Gartin. Dr. Meredith Gartin is an assistant professor in the Department of Health Policy and Organization right here at UAB, and the current board president for the Alabama Interfaith Refugee Partnership, ALIRP, which is a 501c3 nonprofit organization based here in Birmingham. Dr. Gartin teaches courses in global health and migration health for the undergraduate and graduate programs offered here at the School of Public Health. She has worked with refugee and migrant populations for almost a decade. Her research explores the ways in which to advance the inclusion and integration of migrant health issues into immigration policy and with the assistance of grassroots organizations. Her talk today will highlight the issues we face in Alabama, detailing the work of ALIRP and how those issues connect to the broader global migration crisis that we see unfolding in the news. So, and the floor is yours. Thank you so much. Thank you.
So I do have a tendency to move around. I also make a lot of eye contact. So I'm really excited to speak about this. This is a passion project, so to speak, of mine and of others that do this work. And I am going to try to keep it short because I love to have questions about this topic. So feel free to, sort of raise your hand if you've got some clarification. I was nice to see some people I haven't seen in a while. So I'm looking around the room. It's so nice to see some friendly faces. But I will have some time at the end to leave some questions open. So I am a professor of global health. And those of you who have had any classes with me should find this definition a bit familiar. Global health is a collaborative transnational field of research and practice that places a priority on improving health and achieving health equity for all. And that is kind of one of the most commonly mushed together definitions that we use in the field of global health. I like it because I like that it has with it a vision and ambition. It sets forth a goal. And I think that that is a goal that is an admirable goal for us to work towards. And to me, migration is global health. Migration is transnational, and we do see that migration issues as they emerge become inequitable because of the way that we have certain structures in place to meet the needs of those who are migrating. Migration requires international collaboration. It requires improved access in healthcare, and it requires advocacy. Particularly in areas for people who are seeking refuge and asylum. So we're going to do a little vocabulary lessons. One of the things that is kind of confusing sometimes is that there's a lot of language that is used to characterize different groups of people. That is all built within our policies. And so we have policies that define what a refugee is versus what migrant is, but we use migrant and we use migration in really fluid ways. So I wanted to show that in this way, migrants are considered people who are voluntarily leaving their homes to settle permanently in another area. Sometimes the news will report migrants as those who are also forced migration, but for the purpose of this conversation, I am going to be focusing on those who have been forced to flee. People who are forced to flee are displaced peoples. And people who cross into international boundaries are often given a label as an asylum seeker or as a refugee. But there are IDPs, internally displaced peoples. And those are people who are displaced within their country. and unable, for one reason or another. Most often displacement is related to, civil unrest and war, but it can also be an environmental impact as well. So, Hurricane Katrina many years ago internally displaced many people in the United States, right? We see that with environmental catastrophes and the need to evacuate an area for a period of time. But most people who are internally displaced sort of have the hope that they're going to be able to return back home. People who are displaced outside of their country, that becomes less of a likely scenario. And then we've got this fun thing where refugees and asylum seekers are both forced to leave. But if you look up the definitions, they almost look the same. So what makes them different? A refugee is one that crosses the border. And this sort of definition says that asylum seekers are those that claim refugee status. So let me put it to you a different way. Let's say someone is fleeing their place. They are an asylum seeker. But if they get to a UN camp, or if they get to UNHCR officer, or they get to an embassy, and they can then sort of claim their asylum, that UN office can sometimes grant them that refugee status. But if they don't have that option, then it makes it harder, so they remain an asylum seeker. So when they walk into, say, the US border, and they say, I'm claiming asylum, then the state, the United States, has to figure out how to follow up on their story and their claim. Anybody think of any refugee camps in the Americas? Do we hear about refugee camps in America? We have a lack of presence of the UN in the Americas. That is why we see more asylum seekers in the Americas. But we could probably think about some refugee camps, and we certainly see those out of Greece and out of different parts of Africa and Turkey, right? That is where we start to hear that language of refugee come out of the news. So these situations are problematic because being a refugee versus being an asylum seeker holds with it different access to healthcare and services. Now here's me using migrants in a funny way again. So 272 million international migrants, and that's 3.5. So that's people, that definition and that statistic that's out there in the world right now includes those who are seeking kind of an economic opportunity, kind of the way migrants is defined on this slide, but it also includes people who are displaced. Proportionately larger displaced people within that statistic. 272 million people. That's a lot of people. I like to put it into context of global population. So if we look at the top 5, India has the most population. We look at China, we look at the United States, we look at Indonesia. And if we thought 272, that knocks out Pakistan in the top 5. And this is an area and a group of people that, depending on where they land in the world, they have different access. It's not universal access. So we're talking about a massive group of people, and we're sort of relying on our governments and our UN agencies and some of these global entities to internationally cooperate to come up with ways to kind of fill some of those gaps. Now, I always like to present these kind of ideas of push-pull factors. There's a lot of reasons why people migrate, and things can push people towards migrating, and then there's also the draw that brings people to a place. That's the push and the pull. And traditionally, when we think about migration and immigration, we think in terms of economic opportunity. And that's a big narrative that we have in the United States anyway, is that we are all a land of immigrants that have come here for great economic opportunity. And that gets challenged a lot. It might be a cultural value that we have, but it's not necessarily translated into our policies. And that's why I do a lot of the work that I do. And that's why it requires a lot of advocacy. So I'm going to talk now. So we've kind of talked a little bit about migration. Now I'm going to whittle it down until we get down just to asylum seekers here in Birmingham. This is some statistics of trends looking at refugees and asylum seekers. So these are displaced people who have crossed borders. And you see these peaks, and it might be hard to read it, but these are showing major wartime issues. So Afghanistan, Ethiopia, here's Syrian fleeing, here's Venezuela and Syria. And then here it says 5.7 million people fled Ukraine and 4.4 million other nationalities, primarily Afghanistan and Venezuela, right? So there's always kind of a steady bunch of people who are displaced sort of for various reasons. But when we see a catastrophe, then we see a major spike, right? And if you remember, when we pulled out of Afghanistan a few years ago, our military pulled out, we had promised refuge and asylum for those who had worked with us. And so that is kind of where you start to see some of those peaks too, is that us trying to resettle some folks that were allies to the United States and now feel forced to leave. Oh, I already did that. So how do you get to the US? Well, it's not simple. It's rather complicated. Now, if you are a refugee, that's number A up top, and you're fleeing persecution, you can sort of have your case evaluated by the US State Department, that's usually at an embassy, you know, or some kind of like facility abroad. UNHCR, the High Commissioner of Refugees, UN agency that works with refugees, they can follow up on your case. And DHS, which is Department of Human Services, DHS, Homeland Service, sorry, DHS. And so these kind of are areas where these groups interact and they say, you know, how many refugees can you take United States? And the United States, oh, we can take 5 million. Okay, great, right? That's an extraordinarily high number. And they work with other countries too. But highlighted here is that that happens overseas. So they're granted refugee status before they come to the United States. Refugee status offers them all kinds of support. Not great support, it's still not sufficient, but the federal government will provide up to 90 days of resettlement support, helping you find housing, helping you get enrolled in school, providing you with the stipend, getting you set up with your health care, your Medicaid, or whatever it is that you might need for you and your family. And then it usually hooks you up with a locally based resettlement office wherever you've gone. And those are usually nonprofits that are affiliated and tied with that connection with the UNHCR. And then those nonprofits and those agencies that help with the resettlement usually take on that case management of those refugees for up to a year or more, because we all recognize that 90 days is kind of not enough time. I moved here from the state of Ohio. I didn't have my driver's license fixed in 90 days. I had to go to Bessemer, right? I didn't know I had to go to Bessemer. I went to the one place over there on 78 because I'm out of state, so I couldn't go to like any other DMV. I had one DMV that I was able to go to. And I got there at like 9 o'clock in the morning and they were like, we're not taking anymore. We're all booked. You can go to Bessemer. So here I am. I've never been here before. I've never been to Bessemer before. And I drove out to Bessemer. Then I had to haul it back into town because I was teaching class that day. So 90 days for me as an American citizen was really, really hard to do. 90 days for someone who might not even speak English, virtually impossible to do. Now, asylum seekers have affirmative asylum, which is number B. And that's where you cross the border and you say, I claim asylum. And then they shuffle you over here. Now, you might even enter on like a valid visa, meaning maybe you're a student visa, or maybe you have a tourist visa, or you got some kind of documentation that says you can come in. So then you can say, hey, I got a claim asylum. Here's my case. This is why I can't go back. And then they bring you in and they have a nice interview with you with the international, the immigrant services, the US Center for Immigrant Services. And this chart makes it look like it's real straightforward. And then you're granted asylum, or you're denied or referred to another agency to follow up on your claim. At which point then you go to a judge and then you have a court case and a hearing. And then the judge either says, oh yeah, you can stay, or they say, no, bye-bye. Or they keep you here. That's problematic. Now, if you are seeking asylum in the United States, you don't have access to work without a proper work permit. And when you claim asylum, you have to wait 150 days before you can apply for a work permit. So we stay kind of in this holding pattern. Now, there's something else called defensive asylum, which is down here. So you can see if they are denied, they can appeal. Brings them back here. And so now they have to go through it again. It's harder when you make an appeal, right? And then you've got others who request asylum at the border, and they then have to go through detention, they're held, you have to meet and have that hearing, and then again, we just don't know. And during that period of time, you're unable to work, you're unable to earn money, you're unable to see a doctor unless it's provided at the detention center. They've been shutting down a lot of detention centers, which is a good thing and a bad thing. The good thing is they were totally insufficient. But the bad thing is, where do we go? Who can sponsor? And if you're watching the news right now, you're seeing them be shipped, people being shipped all over the country and landing in places that are insufficient to take them in. So these are real challenges that we face that are just politically, structurally making it harder. We've seen an increase in asylum claims. And the US is the largest recipient of people seeking asylum. And that comes back to that issue of there's just no UNHCR or other agency really present to help carry that load. And in fact, there's been the United States saying to the UN, saying, please, designate this a humanitarian crisis and show up and come here. And they keep denying that request. That's another sort of structural challenge that we're encountering. And this was 2022. This isn't surprising, knowing what we know of the world, right? But I always like to show what happened pre-COVID, because we sort of live now in a pre-COVID, post-COVID world. So pre-COVID, Venezuela was in the top 3. Ukraine and Afghanistan over those couple of years really pushed Venezuela down, but still in the top 5. So think, looking at these countries that are not in the Americas, lots more refugee status being granted. But the one that's in the Americas, we're encountering challenges. Mixed population, mixed kinds of ways of doing it. The government did open up to say, okay, we will be granting more efficiently refugee status to some Venezuelans. We do that also with Cuba. There's a couple of countries that we have longstanding sort of relationships with, but it's still very challenging. This is just to also really emphasize that people seeking asylum is growing. So the blue is the refugee and the purple is the asylees. And 2006, 2007, that was around the time that Haiti had an election year, as well as an earthquake. And so a number of people were displaced. So that asylum category there is really kind of Haiti. Colombia also had some things going on that year. So that's sort of taking up a large proportion. So again, another kind of catastrophe, historical event shaping the way that people are kind of getting jostled up. These are the asylum claims through the US. So the affirmative is in the darker blue, the defensive is in the lighter blue, and some years are just even over the map. So you can see that the defensive is also kind of increasing. right? It's not just the affirmative. And that defensive are the ones that are having to go back, make an appeal, or came in on a visa. I just also want to say that sometimes we had a defensive claim that we were helping with ALIRP. Sometimes you can be here on a tourist visa, say from the Ukraine. That was this case. The Ukrainian was here visiting their family in Birmingham. Their family live here. They came over to visit, and then the war broke out. And now they can't go back, but their visa's up. So that's a defensive asylum claim. You can't continue to do your visa sometimes, and you're afraid you don't know when you can go back. So even if I extended my visa by a month, I probably can't get back. So then we help that person claim asylum. Students are similar. You're here on an international student visa, something happens back home, and now you can't get back, but you're graduating. So what do you do? And those are some other defensive asylum claims that get made, where you're here legally, but something happened and you can't go home. And we just don't have a structure in place to really satisfy that. So international students, you have international students insurance, you've got some housing support, you've got support here for the school, but then you graduate. Now what do you do if you can't go back? Here's some numbers of people seeking asylum in the United States. And again, some areas of Latin America and South America are really topping off the list of people seeking that asylum. So that's kind of giving some characterization as to what's going on. We're terribly backlogged. That's a longer story for another day. But the bottom line is we don't have enough judges, we don't have enough attorneys, and we don't have enough people to handle the caseload that's coming through. And if you can't get your asylum case heard and you're backlogged, it can also affect your ability to get that work permit, because the work permits are also backlogged. So the backlog right now is around, I think, 761 days. What do you do? You can't apply for health care. You can't get a driver's license. You can't work. Like you can, if you have a work permit, you can work, get a social security card, start paying to the government, right? And then you can start building that self-sufficiency. Can you get access? Yeah, if your employer provides it and if your work permit allows it. Some of the work permit promise that we're seeing now is we've had a few people get their work permit, but the government has it at the start date from when you applied, not the start of when you got approved. And so the work permit is often 1 or 2 years. So we've had people get it in the 11th month of their application and only have 1 month. So then they have to pay to apply for the extension, which is further backlogged, right? Crazy. Can they receive Medicaid and CHIP? Maybe, depends on the state. I bet everybody knows what Alabama thinks about that. Can they buy health insurance through the state? Maybe, depends on the state, right? Same thing. Can they buy through the marketplace, the national? Yes, with a valid work permit, right? So this work permit is really critical to getting people on a good foot, whether their case of asylum is being heard or not. All right, state by state. January 2024, posted by the National Immigrant Law Center. We have health coverage for pregnant people. Okay, Alabama not shown up. Okay, health coverage for immigrant children. Medicaid, CHIP. Not showing up. All right. So we have a problem here. How do we solve that problem? A lot of the literature will point to the civil society. And the civil society are these organizations that are sort of positioned. They're not private sector, they're not public sector, they're other sector. They're community citizens who are taking up the charge, organized in some kind of fashion, and trying to fill that gap. Grassroots. Some of our civil societies here, our groups in Alabama include HICA, Hispanic Interest Coalition for Alabama, great organization. They've expanded the training services for DOJs. DOJs are Department of Justice folks who can help process those applications. But it's still a challenge and you still encounter the backlog. The ACIG, Alabama Coalition for Immigrant Justice, which is a major advocacy group. The Alabama Interfaith Refugee Partnership, ALIRP, that's the one that I work most with. And Inspiritus. Inspiritus is a resettlement refugee agency that has opened up here in Birmingham and Huntsville. They also have offices in Savannah, Atlanta, and Nashville. So when we became an organization, we were also managing, kind of doing sponsorship for individual refugees, but we weren't designated with the Department of State as a refugee resettlement agency. So we advocated and sent letters and helped the application for the Department of State to open up Inspiritus here. And we got it approved. We got it approved a month before they started evacuating Afghans, humanitarian parolees. So before they even had an office space, which HICA was really nice to offer them a room, they brought in 50 Afghans here to Birmingham. It's pretty incredible. And one of the things that we found out in that process was the humanitarian parole piece of document that they were given, when they took it to the driver's license, because they can get a driver's license, and they've got Inspiritus, the refugee resettlement agency, taking them there. When they took them there, we didn't have the app to read the form, so they were denied. It's a government paper, but no one is trained in the state to read that paper. So we took about 6 months calling and calling and calling for somebody to have training. So now we have one DMV that can review that paperwork to provide a driver's license, which is great. One is better than none. But if you come in through Mobile, which is another place that does resettlement, somehow they have to get them up to Bankhead DMV. You come in from Huntsville, somebody has to get you down to Bankhead DMV. So that was an interesting thing that we learned. And about half of the people that we brought over in that first round left for other states because they had a network of people that they had been working with, and they were like, hey, we're in Ohio, we just walked in, they gave it to us. Right? So this is a big challenge that we're finding within our state of Alabama. And part of what we focus on after we were able to bring Inspiritus here is we really tried to focus on asylum seekers, because Inspiritus, as a designated State Department office, they don't work with asylum seekers, they only work with refugees. So who works with asylum seekers? Those who want to, right? So how did that all get started? The Unitarian Universalist Church of Birmingham in 2015 organized kind of a task group. They said, we've really got to do something. They were seeing what was unfolding in Syria, and they took action. And they did a couple of resettlements. Those are pictures of the original board members. Some of you might know Dr. Linda Wilson, who was over in nursing and helped with the PAHO Center there for a number of years. She's retired from the university, professor emeritus, and helped to lead this initiative. As time went by, they decided that they didn't want one doctrine to be sort of navigating this organizational group. So they made it an interfaith agency, put in the application to become a nonprofit, and gained that status in 2019. Coincidentally, that's the year I moved to Birmingham. And I was like, hey, what's going on in the migrant refugee world around here? That's a big area of my interest. I'd been working with refugees in Ohio, and I'd been working with migrants and asylum migrants in Arizona for 10 years prior to that. So I came here, I was like, what's going on? And they were like, I think there's an agency. I think something opened. So I started volunteering with them and joined the board in 2020. We just had our board retreat, I just want to give shout out. Linda is retiring from our board and our executive director, so we were able to give her a token of our appreciation. And these are some of the original board members that showed up, as well as other volunteers that have joined us since that period of time. And that was a wonderful thing because it really started with an organization that were concerned citizens who came together and said, we have to do something. And now we have staff, we have a large board, we have a pretty decent budget. It could be better. And we have this network that we've been able to establish here in Birmingham, and we're continuing to grow that network. It started with one family, and now we have, and this number, like, these changed so much, so this number is already wrong. But these are the number of people that we help support through our agency. And we don't think of it, we're not a social welfare agency. We're a partnership. So we have kind of an intake form. We speak with families. We can't provide full support. We have to provide what we can. We work with a number of different groups and nonprofits and faith-based organizations to try and fill some of these gaps that maybe our budget can't fulfill. But, and there are people who say, you know, this isn't for me. But what we're trying to say is, and I like to call us the largest welcome wagon in town, because we want to welcome people and make them sure that they can feel like they're a part of this community. We're not lawyers. We can't always advise them on their legal process. We can share resources with them, but what we can be is we can be the concerned citizens that we are and the good neighbors that we want to be, and show them that there are people here that care for them to be here. And so we call them partners. And if you look at it, most are kids. I was giving a talk to the community, broader community in Birmingham, doing some outreach. And I said, you know, the majority of people that we sign on as partners are widowed or single mothers and, you know, 4 to 5 kids. And that person said to me, you're really trying to get us with these heartstrings about the mom and the kids. And I was like, I don't know your heart, but that's our data. I'm not selecting only women to talk about. We have predominantly only mothers with 4 to 5 kids. And that's some of the advocacy work that we do here in Alabama, is to really make sure that people understand that we're not trying to make a story. We're trying to show what the trends are. And we kind of created this sort of what your donation can provide. And you'll see the things that we support. We support utilities. We try to find people to get housing. Anybody trying to rent a place in Birmingham? Boo. And I can tell you, if you're like, we can't pay your normal rent, we can only pay like $800 a month, would you be helpful to us, the landlords? No. So the housing situation in Birmingham, Alabama for asylum seekers is greatly diminished. A lot of the places don't supply heat. They're supposed to legally, so maybe they get a space heater, but that's not sufficient for a mom and her 4 to 5 kids. A lot of the people who do become our partners maybe already have family here, so they've moved in with their families, right? Well, that's okay too, except for it's usually a 2-bedroom house, and now you've got 2 large families sharing that place. So usually we're still trying to find housing for people. Medical, transportation, clothing expenses. There's a lot of agencies and groups around here where we can find clothing. So we often don't have to pay for clothing, we can find clothing, but there are some cases where we have to help pay for clothing. Medical, transportation. Transportation is, you can't get that driver's license, you can't drive. So how do you get your kids to school if they're not on the bus route? How do you get to the doctor? How do you get to the grocery store if you have a little bit of money to pay for groceries? So we have a number of volunteers who act as kind of taxi drivers for our families. We also help people register their kids for school. So what we do is we coordinate a care team around every family that becomes a partner. So there's not one case manager or one social worker trying to work with the whole family. We try to create that welcome wagon feel. So these are lay people who are just helping to show them around town and building relationships, which is really, really important. Those bridging ties, sometimes they call them, are building those relationships to help those people, you know, cope with this major change. And as you can imagine, some are injured. Mental health is a major problem. We had one guy who came in from Colombia and he had been shot 4 times he was a doctor, a medical physician, for treating, you know, what the government had seen as like a hostile person, but it was just, you know, a protester. And so he fled and he came here. He was able to get some other support from other agencies, but he asked us to help pay for his board exams so that he could become a medical physician here. So also that sort of stereotype that everyone's illiterate and ignorant and non-professional, it's not necessarily the case. We do see pastors, you know, because maybe they're fleeing for that religious persecution. And we also see school teachers and we see other people. But until they can learn English language, you know, they're sort of they're sort of at that place where they're in some kind of like blue collar labor or something that's more manual work. We get them set up with English class, and some of our care teams do tutoring with everybody. We do provide legal expenses. So if they decide to become a partner, we give them a check and a referral, and we say, go get an attorney and right away get your asylum case submitted. And then we work with them to also follow up on the work permit. And backlog. I joined the board in 2020. We had a number of partners with their work permits, and this year we finally saw some work permits come through. So of the 11 that we had out, 9 of them were approved. And 3 of them now have jobs. That's a win. That's a win that took a long period of time. Come on up. It's right. Welcome to the show. And then, of course, we try to help with rent. Now, we can't support everyone. We can't provide full support. We can only provide partial support. But we try to reach out to community partners and other faith-based organizations to say, can you help cover some of these costs or cover some of the need? We have 4 families right now that need washer and dryers. You know, you rent here in Birmingham or Shelby County, places don't come with a washer and dryer. You got a mom with little tykes and no washer and dryer, you know, so that's one that we're right now trying to like figure out how to advocate for and maybe do it for some fundraising. So these are some of the big challenges that we encounter as an organization. And we're now starting to think about ways to do some youth mentorship programming, the kind of thing that you see with Big Brother, Big Sister, because we're trying to just help these families survive, but most of the support is coming direct to the parent or the caregiver. But these kiddos, lots of kiddos. And these are kids that are going to be graduating our Birmingham schools or our Shelby County schools. So how can we make sure that they feel rooted to the community and ready to go to college or get some kind of vocational training or do what they need to do? Because kids all of us have a better chance in the community than their parents do in being able to see some economic success. So we are trying to pull together a mentorship program right now to start doing that work. And I'm proud to say that SOPH has been really supportive of me doing this work, but also of finding ways to connect our students to this work. So this is Aguk. She graduated a couple of years ago. She was an MPH intern. She, anybody know her? Yeah. She was born in a refugee camp. And when she found out about the work that I was doing, she was like, I want to do my internship with you guys. So what we developed was a simulation that we ran on World Refugee Day. And she helped write that. And it was a simulation of what it's like to have the intake at a refugee camp, which is very similar to what it's like to try and seek asylum too. And the fact of the matter is you're just stripped of your identity almost instantly. You're given an ID number. They throw all your stuff into a bag, right? It's a dehumanizing experience. And unless you can connect with that, it's really hard to really establish those bridging ties. So AgGroup is really helpful in that. This is AmeriCorps Vista. You know, over in the service learning office, we have AmeriCorps Vista program that does a lot of support by helping local nonprofits and grassroots organizations across the state. They really have helped us to build capacity. That's our first one. We've had 5. So it's an amazing program that's run just right over there. Provides office space, allows us to get free printing. Because free printing, let's say $300 free printing. That could be a washer dryer, right? Jonathan Diaz, he started out as a volunteer for us. He took my class. He was an undergrad in the public health program. He came to my office. He was like, Dr. Gartin, I speak Spanish. What can I do? And I was like, join it. So he started volunteering. He was doing some tutoring. He's kind of the inspiration for the youth mentorship program, because he sat down with the student or with his partner who was an unaccompanied minor. So if you're an unaccompanied minor, you might have a younger sibling, but you have no guardian. And so the state will say, okay, we're going to treat you like an adult, even though you're 15. You can continue to do that, but you have to have a sponsoring agency. So there we are with the unaccompanied minor. And we connected him with Jonathan. And Jonathan sat down and he was like, what do you like to do? And he was like, I like to hike. And he was like, that's what we'll do. I'll take you all over the state. We'll go hiking and we'll practice English. And I thought, what a great way to volunteer with the agency. And through that relationship, he learned kind of what was going on at his school. We found out that the ESL teachers that year had all quit. So there was no ESL. So how was he supposed to be successful in that? So Jonathan is now one of our board members and helping us to do our case management software system. He's also got us in a GIS system, helping us to figure out better ways to connect volunteers based on their location rather than based on their interest. Hey, Divya. She right there. Hi. She's on our board. She also works at the Sparkman Center. Divya is another one that, you know, sort of expressed an interest in the work that's being done here and said, how can I get involved? And I was like, hey, we need help on communications. I think she still likes me. And then this is Jane Vines. She was another MPH student. She has a nursing background and she was here and she took my class and she said, I want to do my internship with ALIRP. And I said, yeah, absolutely. So she did a needs assessment with all of our families and then did a community assessment to find out what resources were available. So if you go to our website and you go to resources, she did the medical, the legal, and the transportation guides. Then we worked with the Spanish service learning class to have it all translated into Spanish so that those guides are in English and in Spanish so that we can reach a larger part of our population. And she's on our board. You volunteer with us, there's a real good chance we'll recruit you to the board. But we also have a number of other undergraduate students who are volunteering, who are helping to drive some families and do some tutoring. We've had about 10 MPH internships come through that we've been able to support at the agency. And we want to continue doing a lot of that work as well. For one, it creates another ambassador for our program and for our advocacy efforts. And it provides those real life skills for an area that is growing in this state, but we really are not creating the kind of curriculum that we need to see so that we can meet some of the needs. Sure, there's clinical social work, and that can be meaningful here. But when you think about the trauma that's affecting people, it's a whole other kind of level of a toolkit that we need to be working to develop within the skills of our graduates. Yeah. Hopefully coming soon to 2027. But I think like these are all ways to connect. And there's other agencies like I showed earlier. So if any of you are interested in those, look at those agencies. see how to volunteer, join the newsletter, follow them on social media. Check out what's going on, because there are ways to be actively involved and be engaged in the work that we do. And that's for questions. Oh, good, no question. Yes.
How do the refugees, right?
Yes.
How do they contact the organization?
The refugees, or, yeah, so refugees are often, yeah, already connected. The asylum seekers are by referral. So if they already have family members here, that's been historically our referral process. But now we're getting people who are finding us by Googling us. And we also have built a larger network. One of the things that Dr. Wilson had done was create the Birmingham Immigrant Resource Network, which there was no integrated network here in Birmingham, and the mayor's office was like, we're kind of interested. So we coordinated that. The mayor's office managed it for about a year. HICA now manages it. But they have regular meetings and they come together and they talk about, you know, what cases have you seen? That's been critical. In January, it's only January 22nd, right? So January, we've had 4 referrals to us. And one of them was a woman from Kenya who was being trafficked, like literally in that moment, and had found a way to get away. And so our case manager went and was like, we can't help you because we can't do human trafficking, but we know who you can, got that person to the safe space. Now, we wouldn't have been able to do that had we not had the integrated network. Couple of other cases that came up too, you know, we don't just, like most of our population are Spanish speaking, but we do have other people seeking asylum who are from different parts of Africa or the Middle East. So that also sort of emphasizes our need. We just had someone email us, cold email, that speaks French. So we're like, ooh, look up our volunteer list, you know? So there are ways that people hear about us, and then there are ways that people find us.
I just like the community of what you're doing.
Oh, thank you.
Thank you so much. A lot of people don't understand what this group of people go through. I was once an asylum seeker in the United States.
Oh,
But I know the kind of suffering,
yeah,
and the kind of inhumane situations people go through. A lot of people here don't understand.
yeah,
And they hear an accent, you're like, where you from? Why did you come here? Why did you come here? And you try to explain, and I can see if you live in a country that is so stable.
yeah,
You have good economy, have a government that supports you, where you don't have enough money, they give you assistance, you got welfare, you got this, you know, you got a lot of essentials here. You don't understand what people go through, come to countries where the countries are so destabilized, not because of their own fault,
yeah.
or usually from outside interferences, people really suffer. So I really want to thank you so much for the organization, for all those involved in this.
Thank you.
Thank you for sharing that.
Yeah, I think the suffering piece and the waiting piece is so difficult. You know, one of the stereotypes, again, I hear all of them while I'm out there in the community doing the work. And one of the stereotypes that I hear is like, do you really think they want to stay here? You know, aren't they cheating the system? And I'm like, this system is, you know, you're a mother with kids. You're not trying to cheat a system. You're trying to find stable housing for your family. And that is so critical in helping us understand what's happening globally. You know, it's not 1990 anymore, y'all. It is a different world. And that world has shaped and changed the way that our people are coming to our country. And in the 90s, yeah, it was mostly economic development, mostly, you know, men. That was the major trend, was men. The trend, the global trend of people moving today are women and kids and daughters. And that's hard, yeah. And they want to work. You know, I have yet to meet someone who is affiliated with us
who doesn't want to work? That unaccompanied minor with the English language class shut down was like, why don't I just start working? You know, I can make money and help my brother. And we were like, no, you really need to stay in school just a little bit longer. Just stay in school just a little, like, let us work on the ESL piece, you know? And then that's our board, calling the school district, calling the education program, trying to figure out how can we help support filling this gap that by federal government should be filled, right?
My friend told me this morning that Inspiritus has received or is receiving 35 families
Yeah,
just this month or this time of year.
yeah.
And that they're in desperate need of volunteers right now. For
So-
like this care teams that you mentioned.
Yeah, and Spiritus is just, they've been waiting for the federal government to decide whether or not they were gonna resettle people to Alabama, so us agencies, a lot of us are just sitting there waiting too. And yeah, there is a need, so if you do wanna kind of help, they're in Spiritus, you can sign up on their website. There's Inspiritus at Birmingham, and they're looking for more volunteers. And the state refugee, coordinator for the state, so not just for Inspiritus, is at Inspiritus as well.
How does the federal government make decisions about where people are going to be resettled? And does the state have a say in that?
Yeah, that's a great question. So for those who maybe couldn't hear, like, how does the federal government make the decisions about resettlement? Each state and the governor of the state will say, we'll take 1,000. Our previous governor, our governor, in the previous years, prior to COVID, said, "Meh." But Inspiritus works outside of our state governorship. So even the governor can say, we're not taking any from the state. But Inspiritus can take as an organization. So there's some nonprofits that can claim a resettlement. And since Inspiritus has offices in Savannah, Atlanta, Nashville, Huntsville now, and Birmingham, they can go in different areas. If the governor were to take some people, resettle some people here in Alabama, they go to Mobile. Because that's where the governor's state office is in Mobile, through Catholic Services. Ohio is one of the 5th highest resettlement states in the United States. And they have a number of agencies and a ton of like donorship and support, right? So you can't get government support for asylum seekers, but you can for refugee resettlement. So what Inspiritus can do is they can say, hey, federal government, the Office of Resettlement, Refugee Resettlement, can we apply for a grant to get some more money? And they can get more money. There are a couple of resettlement agencies that have reached out to ALIRP to say, do you guys want to become a state designated, like a U.S. Department of State resettlement agency? And we're like, no, because we could do that. And we could then have access to some of that funding, but it doesn't include asylum seekers. So then we really kind of want to, at this point, as we're still small and as we're still primarily volunteer, want to stay focused on that group. But the governor makes the decision. Then the federal government, president, gets with Congress and all the people, and they say, okay, we're going to resettle like 250,000 refugees this year. And then they decide from which countries do we prioritize that resettlement. And there's a place called PEW Research Center, and they have some really great information about immigration generally. And they have kind of this interesting interactive United States map that goes back about 20 years, and you can run the simulation and see the different like primary ethnic groups that came in. And during like 2000, it was like all Saudi Arabia. The government said, okay, we're going to go into this, war in the Middle East. So let's try to evacuate and prioritize people from that region, right? So a lot of it is politically determined. And then they have that big number from the federal government, at which point they reach out to all the states and say, what percentage share can you take of that number?
One of the earlier graphics that you showed, with kind of the different levels of
the process, right? And
Oh, yeah.
and in certain situations where one of the possibilities is, being denied and leading to deportation.
We've had 3 of our partners be deported. And
So
denied.
what I wonder, and there may not be a clear answer to this, but, is there a way to sort of estimate or quantify maybe how many people avoid even trying to go through that process because maybe they're aware of it's a very real possibility of deportation?
Yeah.
To kind of just to understand how many more people that could represent that.
I call it the modern day Underground Railroad. The Atlanta court, so it's a federal court that hears it. Atlanta is our court. So anybody who is claiming asylum goes to Atlanta. The approval rate is under 30%. But if you go to Chicago, the approval rate is over 60%. It matters, the politics of the region. It shouldn't, justice shouldn't work that way. But it does matter. So one of the things that we try to do, we also have a larger nationwide network that we reach out to and other agencies that we reach out to that work with asylums. So if they don't have family here and a reason to really be rooted here in Alabama, we do try to get them and their case reassigned to another court and sponsored by another agency. And that's a little bit of the work that we do, because we have seen people who have really valid cases get deported and sent to like either where they crossed or sent back home. And one of our guys, he was staying this was a few years ago. We don't have the detention center up in Gadsden anymore, but there was one up there in Etowah. And he was up in that area, and we were able to say, no, we'll sponsor him. One of our board members is going to put him up in his house. They put an ankle bracelet on him so that they could track where he was going. He's not a criminal. He's only seeking asylum. Right? So they don't do that anymore, to my knowledge. At least we don't right now in the state of Alabama. But breaking that stereotype that this is criminal behavior to want to come and live a safe and secure life is part of our major advocacy. Yeah. Because this isn't an easy system to navigate. And the language is in legalese, which nobody can speak. So it's very hard. Yeah. And we do book clubs. That's one of our education programs. And we had one of our authors speak at our book club last year. And he said, these are no shrinking violets. Like, the people who come are strong and resilient and have something that is driving them that is more related to faith than so many of us can understand. And I think sharing that story is important. The problem with sharing stories is so many of these people are being, sought after. So we can't share images of them. We certainly don't want to share images of their kids. And if someone's been trafficked, we don't want to share that image either. So then telling them, it's like, well, then how do you tell the story without a picture, in the United States? Right? So we run into that. We do book clubs to sort of fill that gap. Yeah.
So first I want to say thank you, Dr. Gartin. I found this really informative. It makes me think about the comment you mentioned about how our system is so backlogged in the timeline of it. So I was just recently thinking of last season, if you all are familiar with the issues going on in Haiti.
Yeah.
When President Biden had proposed families in the US who are Haitian can apply for up to 6 members. I don't know all the details exactly, but I know that's an ongoing problem right now. We're now seeing an influx of Haitians come into the US, but just thinking about where that process fits on this, is that still an assignment?
There are adjustment acts, and that's an example of an adjustment act that he's trying to make. We also have been advocating for the Afghan Adjustment Act, and then we added a Ukrainian supplement to the Afghan Adjustment Act after the Ukrainian war. So they put through legislation and they say, hey, we want to streamline this process because we know that we want these people here, right? We've made a commitment and a promise, and we got to streamline that. And so that means that, so when you do this part, you have to pay. There's a fee attached to all of this. Now, That's hard when you have no money, most likely. And it's hard when you've been running, you maybe have lost your documents too. So all of them are paid, you gotta pay to get your documents, all of that kind of stuff. Those acts of Congress wipe those fees away. And say, we'll do it all in bulk. We're gonna hear this whole stack of people in bulk. And so then they get their status faster. The Afghan Adjustment Act still has not been voted for approval. And it's been sitting there for 3 years. Yeah, I follow it. It gets batted back and forth between Senate and Congress. And it's a lot of people, I mean, especially with the Afghan Adjustment Act, we're talking about military. So that's one that actually crosses the political line in a really positive way. We still can't get that. No. I will say too, that when we hear ICE, we think bad guys. Yeah, well, there's also, without the funding to help ICE, we can't get ICE attorneys, which is why we're then down on our court system, because we can't get enough of those attorneys who can hear the federal courses in that course on those topics. So understanding that legislation piece and thinking about those policy pieces is a lot of extra home study you have to do, because I'm telling you, NBC News is not sharing all of those details. They do pretty good, but not the great. We're at time. The professor who has the room next is here, but I think he would allow me 5 more minutes. He says, take it. So if there's any other questions before we break. I'm on the 3rd floor. I'm here like every day. And you can find me. I'd be happy to talk to anybody who's interested in talking further. Thanks guys so much. Yeah. Yeah.